Your cat keeps locking onto the same place on your body. Not your face, not your whole presence. One exact spot. Your chest, your neck, your calf, your hand. They stare, sniff, sit there, tap it, or curl against it like they're drawn by something you can't feel yet. Most of the time you laugh it off. You tell yourself your cat is being weird, clingy, or dramatic. Sometimes that's true. Sometimes it's nothing. But sometimes your cat is reacting to heat, smell, movement, or chemical changes coming from one area of your body before you understand what your body is trying to say. And a harmless-looking habit can line up with something you really should not ignore. In a minute, you'll get the full list, and the last one is the one cat owners remember for years. Your cat is not diagnosing you. That matters. Still, the cats are built to notice tiny changes. A 2025 PLOS ONE study found that cats spent much longer sniffing unfamiliar human odor than their owner's odor, showing how precisely they track human scent. A 2023 scientific report study also found cats respond differently to human emotional odors like fear and happiness. So when your cat keeps returning to one exact body part, it may be reacting to smell, warmth, swelling, movement, or the way you guard that area without realizing it. In this script, you're getting 10 conditions that can sit behind that behavior, starting with the common ones and ending with number 10, the one that has sent more than one owner to a doctor just in time. Stay with this, because the difference between a cute cat story and an early warning can be one appointment. Number 1, skin infection or an infected cut. Cats live through their noses. If one patch of skin is warmer, inflamed, or producing a stronger odor, your cat may keep staring at it, sniffing it, or pressing near it. Even a tiny nick, bug bite, or irritated ingrown hair can smell different when bacteria and inflammation kick in. That lines up with the 2025 PLOS ONE, finding that cats can tell human odors apart with surprising precision. If your cat keeps fixating on one hand, foot, or leg, look for redness, heat, swelling, tenderness, or a spot that suddenly feels angry to the touch. Your move is simple. Check the area in bright light, take a photo, and if the redness is spreading or you have fever, get it seen quickly. Number 2, dental infection or gum disease. If your cat stares at your mouth, hovers near your jaw, or keeps sniffing your face, don't only think affection. Mouth infections change breath fast. Cats can pick up odor shifts you barely notice, and they also read the way you move your lips, chew, and protect a sore side of your face. Research in scientific reports shows cats react to human odor changes, not just voice and routine. Alongside that stare, watch for bad breath, tooth pain, bleeding gums, a metallic taste, swelling along the jaw, or pain when you chew. The action here is not to wait it out. Book a dental exam because tooth and gum infections can spread beyond your mouth much faster than most people expect. Number 3, migraine or sinus inflammation. Some cats become laser focused on your forehead, temple, or eyes when a migraine or a heavy sinus flare is coming on. They may stare, sit on your pillow, or hover near your head because your breathing changes, your stress scent changes, and your whole body goes unnaturally still. In a 2023 scientific report study, cats showed measurable behavioral responses to human emotional odors, which supports the idea that they notice chemical shifts before you say a word. If this keeps happening, pay attention to one-sided head pain, nausea, light sensitivity, facial pressure, watery eyes, or the feeling that your face suddenly isn't yours. One clear step. Track the timing and call a doctor fast if it's your first severe headache or comes with weakness or confusion. Number 4, anxiety or panic episodes. When your cat locks onto your chest or hands right before you feel overwhelmed, that is not random every time. Panic changes your breathing, sweat, posture, heart rate, and smell in seconds. Most cats are sensitive to those changes. A 2020 study in animals found cats can recognize human emotions by matching facial and vocal cues, which helps explain why some cats get unusually focused when your body is in distress. At the same time, you should watch for pounding heartbeat, shaky hands, chest tightness, dizziness, derealization, or the sense that something terrible is about to happen. Your action is to pause and take the episode seriously. If these spells are new, frequent, or feel physical, get medical guidance instead of assuming it's just stress. Number 5. Low blood sugar or diabetes. If your cat suddenly stares at your face, paws at your hands, or refuses to leave when you feel off, low blood sugar needs to be on your radar. Glucose drops can change your breath, sweat, balance, and behavior quickly. In Houston, A cat named Patches reportedly alerted Michael Opiella during hypoglycemic episodes, and pediatric endocrinologist Dr. Michael Yaffe said animals' advanced olfactory systems can plausibly detect hormonal changes in the human body. Watch yourself for sweating, shaking, sudden hunger, confusion, blurry vision, or that weird floaty feeling that comes right before you crash. The action here is immediate. Check your blood sugar if you can, eat or drink fast-acting glucose if you need it, and get evaluated if this happens and you don't know why. Number 6. Blood clot or circulation trouble. A cat that keeps staring at one calf, one foot, or one side of your body may be reacting to swelling, heat, or the way you keep shifting to protect that area. Circulation problems can change skin temperature and movement in a way a cat notices long before you call it serious. One widely reported case involved a cat named Theo who kept his owner awake during a blood clot emergency that doctors said could have led to a stroke. On your side, check for one-sided swelling, warmth, redness, unusual cramping, numbness, or shortness of breath. Your step is not to massage it and not to wait for morning. Get urgent medical help, especially if one leg suddenly looks or feels different from the other. Number 7. Seizure disorder or another neurologic event. This is where the pattern stops being odd and starts feeling serious. If your cat keeps returning to your chest, face, or shoulder before an episode, it may be reacting to tiny movement changes, scent shifts, or altered breathing that happen before you even register them. The BBC reported the case of Lily, a cat in Bournemouth, said to sense teenager Nathan Cooper's epilepsy and alert his mother before seizures. If your cat becomes fixed on you and you also have blank spells, sudden déjà vu, lip smacking, muscle jerks, lost time, or waking up confused, do not brush it off. Your action is to document exactly what happens and get urgent medical advice, especially if a seizure lasts more than 5 minutes. Number 8. Heart attack or serious cardiac distress. When a cat suddenly stares at your chest, jumps on it, or becomes frantic around your upper body, that deserves respect. Cats can react to sweating, shallow breathing, restlessness, pain behavior, and scent changes linked to acute cardiac stress. In Nottinghamshire, Sam Felstead said her cat Billy jumped on her and meowed while she was asleep during a heart attack. Feline behaviorist Lucy Hoyle told the BBC cats may respond to changes in smell, sweating, movement, or physiology. As for you, watch for chest pressure, pain moving into the arm, back, neck, or jaw, nausea, sudden sweat, or breathlessness. Your action is immediate and non-negotiable. Call emergency services. Do not sit there waiting to see if your cat settles down first. Number 9. Breast cancer or a hidden chest lump. If your cat keeps staring at one breast, one armpit, or the same spot on your chest, please don't laugh that one away. Tumors and inflamed tissue can change heat, smell, and the way you unconsciously protect that side of your body. Multiple reported cases have followed this exact pattern. And Kate Kingscribbins said her cat Augie kept obsessing over her left breast before she found cancer there. And an Albany, Oregon woman told KGW her rescue cat's fixation helped her discover a breast lump. Alongside the behavior, watch for thickening, a new lump, nipple changes, skin dimpling, or swelling in the armpit. The action is simple. Book the exam, ask for imaging, and mention the spot your cat keeps targeting. Number 10. A hidden tumor under the skin. Number 10 is the reason this behavior can be more than a coincidence. When your cat returns to the exact same spot for days or weeks, especially if it stares, sniffs, paws, or refuses to settle anywhere else, think beyond surface irritation. A growing mass can change local scent, circulation, tissue temperature, and the way you carry that part of your body. And the best-known cat cases involve localized cancers, including the reports from St. Paul and Albany where cats fixated on one breast before diagnosis. What you need to watch for is any lump that stays, grows, feels firmer, causes aching at night, or sits under skin that looks different. One clear action: if your cat is obsessed with one exact spot, have that exact spot examined, even if it seems small. Kate Kingscribbins is at home in St. Paul, Minnesota, and her cat Augie will not stop going to the same place. Her left breast, not once, not in a random cuddle, again and again. He presses there. He focuses there. It feels odd enough that she finally checks, and that is when the harmless explanation disappears. There is a lump. The tests confirm cancer. What makes the story stick with cat owners is not that a cat performed a miracle. It's that a cat kept reacting to one exact place while everything still looked normal enough to delay. That is the part that hits. Your cat does not need a medical degree to notice change. Your cat only needs to notice that one patch of you no longer smells, feels, or moves like the rest of you. So here is the fast recap. One fixed stare can line up with a skin infection, a dental infection, migraine or sinus inflammation, panic episodes, low blood sugar, circulation trouble, seizures, cardiac distress, a breast lump, or even a hidden tumor under the skin. Your cat may be wrong. Your cat may simply be weird. But if the stare is always aimed at the same place, the smart move is not to guess. Check it. What body part has your cat been weirdly focused on lately, and did you find a reason for it? Drop that in the comments. Now, because one person's story can push somebody else to make the appointment they keep delaying. If this reminded you of someone whose cat keeps fixating on them, send it to them like a quiet favor. The next video breaks down the nighttime cat behavior that looks affectionate but can signal a real problem. Sometimes love is a warning,